Hello, everyone. Thank you so much for joining our brand new Conversations with webinar series. I am delighted today to be joined by a fantastic panel representing lots of different countries and experiences. And we hope that this new series is going to be repeated throughout next year and beyond, because I think there's nothing more important than bringing the voices of all of those people impacted by these conditions to everyone else, so that you actually realize that you're not alone and there are people going through these things alongside with you. Even if you've never met another person living with this condition, there are lots of us out there, and this series is all about bringing us all together. My name is Lara Bloom, and I'm the President and CEO of the Ehlers-Danlos Society, and my pronouns are she and her, and I am dialing in today from London in the UK. And so, Jenny, could you tell us a little bit about you, please?
Yeah, hi, I'm Jenny, and my pronouns are also she, her, and I am dialing in from Essex in the UK today.
Fantastic. And what I failed to say is I'm sitting here, for those needing a visual description, I'm sitting here in a grey polo neck because it's freezing cold in London currently. And I'm sitting in my front room. There is a mirror behind me and a plant. Jenny, if you could do the same, please.
Yep, it's similarly cold here in Essex, so I've got a lovely zebra print jumper on today. I'm just sat on my sofa. I've got some Christmas cards behind me.
Fantastic, thank you. Annie.
Hi, I'm Annie. I have VEDS. I'm dialing in from Washington State in the US. I am wearing a cream crew neck sweatshirt. I have my fireplace behind me. It's a roaring fire because it's also very cold here. Yeah, did I miss anything?
Not at all. Are you comfortable sharing your pronouns with us, Annie?
Oh, yes, I'm she and her.
Thank you so much.
Sure,
Sabra.
Hi, everybody. I am Sabra. I live in Alabama. My pronouns are she, her. I have hypermobile EDS. And I am currently sitting in my living room. I'm wearing a turtleneck. It's not cold to most people, but I'm a cold person. So there we go.
Thank you so much. And I'm so glad that you said your name because I've been saying it long. So Sabra, not Sabra, Sabra. Thank you.
No worries.
I stand corrected. And Anne.
Hello, I'm Anne, or you can call me Anne as well. I'm from Helsinki, Finland, and my pronouns are also she, her, and I'm sitting in my living room, and I have a green shirt on, and there's, I think, peeking my clock on the wall, and then this bamboo thing I have hanging on the wall.
Fantastic. Thank you, Anne. Okay, so one thing that I think that everybody has read about, heard about, is how long it can take to get diagnosed with one of the types of Ehlers-Danlos syndromes, or HSD. And what I found through kind of having the privilege to travel around the world and meet many people from our communities is that everyone thinks the grass is always greener. Everyone in the UK thinks things are better in the US. Everyone in the US thinks things are better in the UK. Everyone in Europe thinks everything's fabulous, and so on, and so it goes. And one thing I can absolutely assure everyone is there is no country in the world that's got it right. There are strengths and there are weaknesses everywhere. But the one consistent thing is that it takes too long for people to reach a diagnosis. And even once that diagnosis is there, whether that be through genetic testing and a known mutation, or whether it's through clinical examination, the management, care and validation is really not there either. I think we're living in a healthcare system that's set up for the acute and not the chronic. And that's a problem not just in these conditions, but in many chronic and rare diseases. So I wanted to ask Jenny, someone, a fellow from the UK, what's been your experience getting diagnosed?
So I always say when I'm asked this question that I was really lucky because it only took 2 years for me to get diagnosed, but I think saying 2 years is a really long amount of time. And after I knew that I had EDS, looking back, you can see the signs all the way throughout my life that were just never picked up before. And the NHS is wonderful. But the main problem, I think, is the long wait times. I was quite lucky to see some people privately to get diagnosed. My diagnosis story didn't actually really start with EDS. It started with a CSF leak. I didn't know that's what it was at the time, but I just had this constant headache for years, and it built up and got worse and worse and worse until I needed help quite desperately. And then I was having all these tachycardic episodes, which turned out later to be POTS. And I went to countless doctors, both on the NHS and privately, who completely dismissed my symptoms. I will always remember this neurologist in particular taking a look at my MRIs and things, and telling me I was being dramatic, basically, and that there was nothing wrong with me. You know, that if anything, I had migraines. And then a couple of months later, when I was lucky enough to find the right doctor, I had a CSF leak. Plus these two other massive conditions, POTS and EDS, out of the blue. So I think it's really tricky to be undiagnosed when you have a chronic condition here in the UK, especially something like EDS, which is multi-systemic, because no one puts all these little bits of information together. And I think that's why it can be so hard.
Absolutely. And people are so envious of our national health system. Not sure what that echo is. And believe that means that we have that access and it's free. And it, you know, and I know from my experience that if I didn't pay for private healthcare, pretty much everything that I've gone through would not have been treated. And so I think, again, that notion of people thinking that it's there. But obviously, when you kind of look across the pond, Sabra, to living in the US, we all know and we hear from people living there with the insurance issues. And actually, sometimes people don't want that diagnosis because it can make insurance harder. But yet then some people desperately need it. And it's all about the ICD-10 codes. And it's really, really hard. Can you talk to me a little bit about that and what it's like to be in the US with hypermobile EDS?
Well, it definitely is difficult. I feel like the biggest thing for me has been the validation, having my symptoms validated by a doctor who doesn't just brush me off and say it's all due to stress or environmental issues. Similar to Jenny, I've always felt like I was lucky as far as my diagnoses. I was diagnosed when I was 12 years old. But that was literally just because I had a persistent mother who didn't believe doctors when they just said, oh, she's just clumsy, you know, because I was always falling. And it got, you know, really bad at that point where, you know, teachers would see bruises on me and they would ask me questions I didn't understand as a child, like, is everything okay at home? And I'm just like, yeah, everything's great. And, you know, I would tell my mom this. And so that's why she was like, no, we have to go see a doctor to see why you keep falling, to see why you're having these dizzy spells. And I never forget it. One time I was 8 years old, and I now know it was attributed to POTS, but my heart was beating, just like racing. And I told my mom I felt like I was having a heart attack. And she was like, how do you know what a heart attack even is? But yeah, so in that regard, I was lucky to have a mom like that. I know a lot of people aren't as lucky in that regard. But yeah, I just happened to, at 12 years old, stumble upon the right people, had my mom as far as a support. But in general, it is just being now a woman of 32. It's still hard to get that sort of validation. I get memories sometimes of when I was younger, and I remember doctors talking around me and just saying, oh, are you sure it's this? And who told you it was that? And are you, even a doctor a couple of years ago said, are you sure it's Ehlers-Danlos syndrome? And I was just like, no, it's not Ehlers-Danlos, it's Ehlers-Danlos. Yes, I'm sure. So, yeah.
Yeah, no, absolutely. And Anne, Helsinki, not what one thinks of as the hotspot for EDS experts, and you are diagnosed with hypermobility spectrum disorder, which is quite a newly penned diagnosis from the 2017 criteria. So talk to me a little bit about how that diagnosis came about.
Well, I say that I have HSD. Actually, I have joint hypermobility syndrome as a diagnosis, because we too use the ICD-10 codes, which do not have HSD in them. So also our healthcare system is a bit well, it's not complicated, but it is. I try to keep it somewhat, understandable, because we do have public healthcare, just like UK with NHS. It's not completely free, but it's really doesn't cost much. Just a couple of I think it's like 36 euros or something to see a doctor or something. It's not like a lot. And if you have a surgery, it's always a fixed amount that you pay, which is, I think, the same daily clinic fee, about 40 euros or something. And you get everything for that, but you have to pay for a small subsidized fee. Then we have specialized care through the basic care is in health centers with GPs, and then we have specialized doctors in hospitals and university hospitals. And then we also have, of course, private practice where you can go and pay with your own money. But then we have occupational health, which is mandatory. But it depends on your employer what kind of coverage you get. They may be the bare minimum that's by the law, or they may add more to that. So it sort of depends where you fall, whether you're working full-time or part-time, whether you're unemployed, whether you're unable to work or whatever. Then it depends where you go, where you need help. And that sort of makes it a bit complicated in a way, because then when I got my first stop, because I work full time, my first stop with everything is my occupational health, because my employer the coverage pretty good, and they do all the the basic healthcare things there. I could go to a public health center as well, but then they would probably ask me, don't you have occupational health? Could you go there? Because they are sometimes overburdened with other patients and a lot of people who don't have anywhere else to go. And also there, you would probably see maybe a different doctor every time, because it depends who's free, how fast you need the help or get the help and whatever. With my occupational health, we have certain doctors, and I can book time with any of those doctors. So I always choose the same one and go to the same one. So I have a relationship with that doctor, and he knows all my stuff, from be it cough to having subluxation or some weird issue with my knee or elbow or shoulder or whatever. And he's seen me through the years with all kind of different things. Obviously, he wasn't the one who made my diagnosis, but I went actually, because mine started, looking back, I know it started when I was young, but the first real issue I had were my hands, which you can see are heavily with all sorts of wrist braces and compression gloves and splints and all that. But at first I got the Raynaud's syndrome diagnosis, and I got medication for that, and that sort of helped me for a bit. My hands were so bad that I had a little dog that she weighed about 5 kilos. I don't know how much that's in pounds, maybe 11 pounds or something, but a tiny dog. And she had really thin and light leash, but I couldn't hold on to that. My dog learned to stop when the leash dropped, because I couldn't hold on to that. And it was getting so bad. So I got that first, but then the hand pains continued, and everybody suspected some kind of rheumatological issue, but my blood work came clean. There was nothing in it, and they didn't know what to do. So I just decided, I Googled a rheumatologist who had a lot of different specialities listed. And I booked the time, went there with my own money, and told him that I need some sort of help. What do I have? Like, what can I do? My hands are so bad, I need some sort of help. And I came out with diagnosis. And sort of after that, it's not that every doctor that I meet knows anything or much about these issues. They may have heard the names or know of the existence of HSD or EDS or joint hypermobility syndrome. But I think, given my age, I'm 44 right now, and I was 30 something, maybe 7 or something when I was diagnosed. I was sort of probably old enough not to be dismissed right away, that they would sort of, I go there and I explain that I have an issue, I have a problem, I need some help. What can I do? What can you do about my hands or whatever it's been? So I feel like I've been taken seriously. And actually in Finland, there are doctors, and in Helsinki University Hospital, there's there are physiatrists, the like doctors of physical medicine and rehabilitation, who take care of EDS and HSD patients. So they actually have, when I got referred there, maybe 2017, 16, something like that, I forget, but they had like very clear path of what to do. I met the physiatrist, and she went through like seeing like, okay, you meet the criteria, that's fine. And okay, what do you need? You need to see physical therapist, you need to see occupational therapist. Then do you need, I have heart issues, which were then eventually, after seeing a cardiologist where I got a referral to, then they were just put up to dysautonomia and just for the heart rate, heart palpitations and all that fun. But then, and then they asked if I needed, well, they didn't draw because I'm working full time. So I had no sort of need for I don't know whether it's a nurse or some kind of other person who goes through the social security things, whether I need some kind of help, or I'm entitled to some sort of help, or need help with applying for a job or whatever. But that wasn't needed in my case, so I'm not really sure what all sort of things they go through there. But it seemed to be really clear that, okay, you go there, you go there. And then the physical therapist would do, they would do all sorts of assessments for me and to see what kind of things I need, make recommendations, and the same with the occupational therapist. And I got like heated gloves for my Raynaud's, and I got first like plastic splints for my fingers and all sorts of things. And then I was sort of discharged from the university hospital, and then went back to the occupational health with my issues. When I had like more issues, the occupational health doctor then can refer me back to the university hospital, or when I needed new splints because the plastic ones would be breaking apart after a couple of years, I was like, I need new ones. Then I went to a local health center, told the doctor that I need to referral to see an occupational therapist. She wrote that for me. Then I went to the city healthcare and not the university hospital healthcare to get like a new evaluation for what kind of splints I need. Wow. And then I got through that. But you sort of, I don't think I would have gone through that if I hadn't been in contact earlier on with the Finnish LS-DANLOS Society. And learned, like, got to know people. It's not, nobody works there. It's basically volunteer-based organizations where people like just a small group of people try to spread the word.
Yeah.
But then then I made some friends and have been able to ask them about things like, what should I do? Where should I go? And then they have been able to tell me to which doctor do I go to my health center? Do I try to get this to my like occupational health, or do I try to get referral back to the university hospital, or how does this go? So it's been sort of knowing people to tell me where to go next.
And I
Sorry,
think we see that.
long.
No, and I think we see that everywhere. You know, that people are so reliant on social media and the online forums and communities because we're all helping each other work out what the best process is. And I think from what you've just said, it tells me a couple of things. Firstly, it tells me don't ever assume that because you're in a country where, you know, we don't have known EDS experts, you can actually get a really great quality of care, because we've just heard from two of us from the UK and the US, and it seems like you had a much better journey and pathway than either of us did. So I think that it also highlights that there is no such thing as an EDS expert. Well, all it is a geneticist, a rheumatologist, a gastroenterologist, a physiotherapist, a neurologist who has been willing to learn and listen and take the time to care for people living with these conditions. And that can happen anywhere. And my heart is warm and glowing listening to that, because it just shows that no matter where you are in the world, you can get that help. And these pathways and these MDT teams can be created. And yes, it starts from perhaps you having got advice on communities online, but even that is such a strength and such a need. And I think that supports the health professionals, because they can't do everything. And I think if it's a combination of all these things, and then as well, like you said, the national organizations and support groups that are doing such great work. Yes, the Ehlers-Danlos Society is here. We're a big global organization, but we could absolutely not do everything without the help and support of the national organizations out there doing the work on the ground and helping those in those areas, because there's different healthcare systems, different laws, all these different things, the politics behind it. And I think you just summarized there how actually everything can come together and really help someone going through that. So thank you. So Annie, as we've heard, there's 5 of us here on this call, and hypermobile EDS HSD is clearly the prevalent type of EDS, but you're living with vascular EDS, and I'd love to hear kind of how you came to your diagnosis, how it's different, because there's obviously usually a very strong family history, not always, but talk to me a little bit about that and what it's like living with a really rare type of EDS amongst the prevalence of hypermobile EDS.
Okay, well, first, my diagnosis story is also, I consider it lucky, like everybody else, just because my dad went through all of that hard work of what is going on here. And he had complications, and that was in 1992, I believe. So I was 8. But we're also lucky about where we live. We live in Washington State, very near Seattle, which is where Dr. Byers is. So I first met Dr. Byers when I was about 8, when he was examining my dad and getting a skin biopsy. So once my dad was diagnosed, it was kind of just like my brother and I had a blood test, and we were diagnosed also. So I don't have that long confusing story of diagnosis. However, if my dad wasn't diagnosed, I don't think my brother or I would have been diagnosed until one of our major events that happened. My brother in 2011, he had a bowel rupture, spontaneous bowel rupture. He went to the emergency room and was kind of dismissed also. Luckily, he happened to have a doctor who was like, oh yeah, this is probably serious. We're going to keep you overnight. And with me, it was kind of the same thing. I had some pain. I went in thinking it was a kidney infection. And I think all the other doctors in the emergency room did too, because I was kind of shoved into a closet where they had all the warm towels. And it wasn't until I had gone through blood tests and CT scan, and I think an ultrasound, where they're like, oh no, you have a renal artery dissection. We need to transfer you hospitals. So, I mean, And if it wasn't for the team in Seattle, I definitely would not have gotten the care that I did. And also my mom being a nurse for 30 some odd years, her having that knowledge of, hey, this isn't right, we need to figure something else out, definitely helped as well. So, and I'm sorry, I don't remember the other question you asked.
Well, you kind of answered most of them
Okay, good.
there. But so tell me about what it's like navigating living with VEDS, because we all, I think everyone here, myself included, can all relate to this being a scary path, you know, living with a chronic condition that has, you know, no cure, no treatment really to speak of, and something that you have to learn to dance with for the rest of your life. And that's the case for every different type of EDS. But with VEDS, you know, like you said, a major event could mean that, you know, within minutes, hours, that could be life impacting. And I know that you've experienced a few of those. So talk to me about what that's like day to day and what that fear is like.
Well, okay, so it's my fear grows when it's near certain dates. Like yesterday actually was the 26th anniversary of my father dying from his aortic aneurysm. So it definitely brings some fear when those dates are near, or like near my birthday, because I wasn't supposed to make it to my last birthday, which was just about 2-3 weeks ago. So I mean, but on other days, if I'm not thinking about it, I am my happy, carefree, kick in the pants self, you know, like I want to go have some fun. I want to laugh. I don't know what tomorrow brings. So don't get me wrong, there are days where I want to sit on the couch, and I do sit on the couch and I watch my reality TV shows and have a good time. But I mean, I've had a long time to accept it. And it is just one of those things where I take it day by day. And if I wake up in the morning and I'm feeling good, then heck, I'm going to have a great day. And if I'm feeling bad, I might have a bad morning, but I might drink some coffee and take my dog out, and things are great. And you just have to constantly, I don't know, tomorrow's a new day.
Absolutely. And let me tell you that this is not just words. When I first met Annie, she was talking to Dr. Shalhoub about when she had recently jumped out of a plane, and how she had petrified everyone, because that's just like the one thing you must never do with VEDS. And it was like, Annie was like, I'm going to do it anyway. And is that picture up on her wall in her office? Has that come to be yet?
It should be. I thought she has it. I know that for sure, but it should be framed and up on her wall for definitely. And I think everybody needs to go skydiving. I mean, if you have to do it virtual reality or in one of those air tubes, do it. It is the most exhilarating experience ever. I don't know if I do it again.
I mean, you are a daily inspiration to me. You really are. But I don't think I could jump out of a plane. I just couldn't do it. I'm too scared of heights. And I couldn't do it. But
so you know. Funny thing, I was the first one on the plane, so that means you're the last one off.
Oh.
So I'm seeing all these people falling out of the plane. I'm like, no, I don't want to do this anymore. But you're strapped to somebody, so you have to do it.
You have no choice. You're going out that plane.
Yeah.
But you've got some awesome pictures and memories to show for it. So truly living life every day to the max. So 2020, what a year, huh? And I think weirdly, and people kind of either look at me and nod or look at me like I'm mad when I say this, but I think 2020 is going to help those living with chronic and rare conditions. And I say that for a few reasons. The first one is that long before COVID, there were many people in our community that were unable to work, that were unable to leave the house, that couldn't touch people because of severe allergic reactions due to mast cell issues, that couldn't leave the house easily for physical issues, for some mental health issues. And that was normal. And there was zero understanding, funding, research, attention, understanding, compassion, anything from society for those living with these chronic conditions. And then suddenly a global pandemic hit where everyone had to stay at home. Everyone, workplaces, finally offered the accommodations that they should have been there forever for people that couldn't come to the office. Now, if you want to work from home, they'll provide you with desks and chairs and internet, and they'll make, there's offices in London where they'll send you free lunches whilst you're, at home working. Why was this not always in place for those with disabilities, for those that needed that help? That just, to me, it makes me raging angry, and it makes me grateful, because I think that the tides are changing and people are realizing that we don't live in a world where it's not possible. It's look how much has been accommodated in such a short space of time. And so for that reason, I feel like the world will be a little bit kinder to those who this is their reality long term. A vaccine's not going to change that. But I do think that this year has also brought up other things. In January of this year, we launched our Breaking Down Barriers campaign, because we know, and we've been hearing from our community, that there are so many barriers to getting these diagnoses, to getting this care, to getting this management. And that can come in many different forms. We're all women on this call. We've heard from many that say that being a woman has created barriers. We've heard from many that said being a man has created barriers. Sexuality. I know that when I was 16, it was when I was my illest, and it was also when I was coming to terms with that I might be gay. And so I was kind of the awkward kid that cut their hair short and slumped about and didn't really fit in. And so when I was always in pain and when things were hurting, it was like, oh, it's, a bit of depression, or it's, she's a hypochondriac and it's because she's going through maybe questioning her sexuality. And it was like, suddenly that was a barrier to me being legitimately cared for and acknowledged in terms of my physical health conditions. And this year has highlighted that in ways that, again, have not been discussed. And I think that's largely thanks to the Black Lives Matter movement that has happened and highlighted that. And Sabra, as a Black woman, talk to me about the reality of that. Has your colour been a barrier to getting healthcare in ways that we've heard so much about, that's, upset me and frightened me to my core of the realities of how real that is for so many, especially in the US?
So it's definitely an experience I've unfortunately dealt with throughout this whole journey. Like I said earlier, I was lucky in getting a diagnosis early, but it's like you go through all these barriers of, okay, it's someone always questioning it or questioning my symptoms and saying like, are you sure? And talking to me like I'm a child, even when I'm as able as we can, able-bodied adult, or just always looking, kind of down on me. My most recent experience, it's very fresh in my mind, happened this time last year almost. I had really bad pains, physical pains, cramping, like when it was, I'm not trying to get too graphic, but it was just like I was constantly bleeding, if you understand what I'm saying. And I was going to an OBGYN, this renowned in Maryland. Everyone talked about him, said, oh, this guy's great, da da da. He was a white man. And, I was explaining my symptoms to him, and he literally was just blowing it off every time. He was just like, oh, sounds like, you have a stressful job. You said you work for the federal government. And I was like, so my job is causing me to bleed for months at a time. I mean, like, it just, I was trying to say it out loud and he was just like, yeah, I mean, a lot of people experience stress, blah, blah, blah. Just, don't worry about it. We can change your birth control pill. And that was it. And I talked to someone else almost in the same practice as him, actually. And they said, oh, well, because I feel like now, unfortunately, I have to ask oftentimes when I'm calling an office like a rheumatologist or a neurologist, I have to say, do you have a woman there or do you have a person of color there? Because I feel like those are the only people, unfortunately, as I'm getting older, who have really listened to me. They happen to, in his same practice, have a woman of color there. And I said, okay, I want, an appointment with her as soon as possible. I talked to her. She said, oh my gosh, let's get some testing. Long story short, it ended up being like I had 10 fibroids. They were about the size of, she said some of them were the size of like golf balls. And she was just saying, this is why all of this is happening. And she's like, no, you need to get surgery. I had emergency surgery last year, and thank God it's been a year and that hasn't been an issue anymore. But it was very frustrating because I was talking to this world-renowned doctor, is how people were telling me. And had I not done my research myself, I don't know what would have happened to me. I don't know what kind of experience I would have had. So that's been difficult. I mean, there's been many examples of those where, again, people were talking around me even as a child. And my mom was the type, she was just like, okay, thank you. And she would just get up and leave the doctor's office when she felt like they were being dismissive or belittling with a lot of things. But it is tough because a lot of times as a Black woman in the United States, I feel like when I'm talking about my pain, my issues, what have you, sometimes people think I'm trying to be a victim. And that's been difficult, especially this year with everything that's been going on. It's a lot of people saying like, oh, okay, yeah, sure. So it's been tough.
Yeah. And do you think that, as well as that emergency surgery being such a relief, I bet the validation alone was so healing in itself?
Oh, absolutely. I mean, as we all know, it's almost like, oh my God, I want to hug this woman, but she was just like, let's get some testing done first to see what's going on. She wasn't just dismissive there. And then when she saw things going on, she said, no, we need to get this taken care of now. So it was very validating. It was very affirming. And I know that everyone in our community just is like, wow, it's almost, you believe me, like, I don't need to show you my book here of medical records, you just off of my word. So that was very affirming.
Yeah. Whenever I speak to medical students or doctors, and the first thing, they always have through their training and in their heads is first do no harm. And I think drilled into them is the physical side of that, do no harm. But they don't realize emotionally how much some of them do harm without knowing it. I truly believe without realizing it. They're busy, they've got budgets, they've got targets, they've got limited time in those appointments. But I always say, when you have that in your head, first do no harm, actually think of the psychological and the emotional before the physical, and you'll get a lot quicker, a lot further, and the patient in front of you will be so much more grateful for it. Because I truly don't think that doctors realize how much that validation could change your quality of life, short term and long term. And I pray for a day where validation isn't in everything I say, because it's just absolutely not a given. Jenny, talk to me. When I was saying we're all women on the call, and that may have been reasons to have barriers, you were nodding. Is that something that you've experienced?
I don't know whether it's being a woman or because I was kind of 19 when I was trying to get my diagnosis, and I was at uni and I was very much kind of on my own and isolated while I was going through the beginning of my symptoms really getting very serious. But I think also, I was saying earlier about looking back through my life, you can see where the EDS was coming from. And I was 10, 11 years old and would get these awful headaches and these growing pains and all the classic things that everyone with EDS says they've had when they were younger. And it was always, oh, it's just puberty, it's just that'll pass. And I think, again, as soon as I got to university and was having all these symptoms, especially my POT symptoms with the tachycardia and the fatigue, it was anxiety. And, I know that I have a level of anxiety. I'm not ever going to deny that. But the problem was they weren't even going to treat me for the anxiety. Like, I that's what I can't get over, is doctors saying, no, there's nothing mechanical wrong. It's a mental health issue, and then not giving the mental health support, because I think we need more mental health support for anyone going through a chronic illness diagnosis, because there's a huge impact, and whether that's from the illness itself, from external factors, or from the not getting the validation that we deserve. And I think so many people aren't taken seriously because we're young. We should be fit, we should be healthy, and they can't see beyond the person that is sat in front of them to go, no, actually there might be something more serious going on here.
Mm-hmm. And I think you touch on something really important, because I'm constantly campaigning for all rare and chronic diseases at the point of diagnosis to have those kind of long-term pathways in place, physical and mental health support, because it's so important to think about the two and have that bridge between the two, because if one is not being cared for, then how can the other work, really? But I also see that hi Jason, I I also see that is an issue. Hello. I also see that that's an issue not just from the health professionals not offering it, but also from the patient community not wanting to have it. And that is because of a long experience of being told it's all in your head and it's psychological. So the thought of them being offered or taking up that kind of mental health support, you're kind of scared that it means that people still think it's in your head and that it's being treated as a psychological condition, which of course is not true, far from it. Anne, tell me about the kind of that how that's seen in Finland, and if that's something that people are kind of receptive to accepting that help, or if it's a bit of a kind of thing that people don't really like to accept that help.
Well, that's a hard question, because my stuff's been mostly physical, just like body breaking apart, basically. So, and sort of, I was always raised so that, oh yeah, everybody's got something, because, my mom was the same. And my dad did sports, he ran marathons and all that. So everybody in my family had something going on all the time with their body. So it wasn't like anything abnormal that something happened, and you just moved on, and then there came the next issue, and then you fixed it, and next issue. So I've sort of been just grateful for the things that people have helped me, whatever I've been able to get. So it's sort of, I've not had to seek mental health myself for these like after the diagnosis, anything. They've all just been a relief to me that, okay, there's something that causes this. And, it's been difficult, or different that way. But I do know that obviously that some people struggle after they get their diagnosis. Some people struggle because they're not believed and they don't get their diagnosis. And there are different things, but I don't think that mental health issues are sort of viewed as necessarily a bad thing. People do want to get help that way as well. But maybe then for some people, it can lead to that everything is put down to the mental health issue, which but then again, it depends on a person, on the doctor, on the path you are on, and where you get referred to, and what sort of the first thing that you get diagnosed with, whether it's a mental health issue or whether it's something else. And I also think, I don't know if it really has anything to do with mental health issues or anything else like that, but with the doctor's appointments, any doctor, it's sort of the fact you said that they want to help you, or they don't mean to say things to sort of belittle you or to put you down. They want to help you with what they have. But then it's also the thing that the doctors are speaking the language of doctors. So they speak to not always and not everybody, but some doctors, they speak the medical language, which I don't know whether it works the same way in English language as it does in Finnish language. But there are certain terms, like not medical terms as such, but they can be just normal everyday words, but in the medical field, they are used to mean something specific. And then when they use those words to the patients aren't on the same page with the doctor because they don't necessarily understand that the doctors really mean that specific medical term with that word they use. And then the patients sort of are thinking that, no, that's not me. I don't, that's not what I want to talk about. And that's not, even if they are actually trying to tell you something, but then just the two worlds don't quite match or connect.
Yeah, no, absolutely. And Annie, being diagnosed with vascular EDS comes with a host of things that you can't really comprehend, kind of mentally preparing yourself for that. When, like you said, you live in pretty much next to one of the most world-class centers for VEDS, is that something that is there as a package and a pathway that's offered at that point of diagnosis, or is that still really not the norm?
I don't think that's really the norm. So when my dad was diagnosed, he was airlifted up to UW where Dr. Byers is, and he was in surgery with a vascular surgeon. And the surgeon who was doing this was repairing, I think, his bowel, and was like, this isn't right. And it just took a long time. He said it was like wet tissue paper. And him having the knowledge of so many years of being a surgeon, he knew that this was something with my dad's connective tissue. So instantly went to Dr. Byers, who at the time was doing a lot of various other connective tissue research, I believe, and was focused on VEDS. And I think because of all of that, the network that they had in UW, that was the reason my dad was so lucky at being so quickly diagnosed. And I mean, because I have that network, and I've always had that network of Dr. Byers, I feel really lucky. But there's some people that I'm sure are diagnosed and don't even know Dr. Byers exists until they get on Facebook, and everybody's like, oh, Dr. Byers on the West Coast, Dr. Dietz on the East Coast, and Dr. Talib and all this stuff. And I think that's where a big part of Facebook and social media really comes in with these chronic illnesses that don't have a lot of knowledge in the medical community.
And have you been offered mental health support as part of that process?
No, I've had to always go search for it. What bothers me most is I've always been diagnosed as depressed because since my dad has died, but I think I have more anxiety than depression, because there's times where my heart is racing and I can't breathe and I feel like I'm going to die, but people are like, oh no, that's just depression, you're just depressed. And it's like, but yeah, I'm not like this every single day or every single moment. And I just think that there does need to be an option for that, because a lot of people don't take mental health seriously.
Yeah, to me, that is just mind-blowing, because how, I always say when people Anne, you touched on it, that your problems have always been physical. I don't assume, I would never say that I have anxiety, depression, that I would need to have mental health support. However, I don't think that anyone in the world could be diagnosed with something, like I said, that has no cure, no treatment, it's going to be there forever, where you wouldn't need to have mental health support to then cope with your new reality. It might be that the job you always wanted won't be there, that relationships are harder, that you might not be able to study in the way that you wanted to. So it doesn't matter that that you might not suffer from a mental health disorder or an anxiety or depression. You simply need that support and help and guidance to navigate the very physical condition that you have. And so to me, it's just, I can't comprehend how, when you get that diagnosis, my dream world would be that the point of symptoms, whenever that is, you get your diagnosis, you're put on a long-term care pathway that addresses the physical and addresses the psychological, not the psychological problems, but the psychological support you are going to need to deal with those physical problems. And if people saw it that way round, then it would just be a given. it's given to you because you need it. And everyone, no matter how healthy of mind they are, what support they have around you, we're not built to live with a chronic condition. We're not built to live with a condition that kills your father, you know, that could impact your life at any single moment with no warning. We're not built to do that. No one is. And the fact that, you know, Annie, you live next to that centre that is just pioneering in every way, and it's not given to you even to deal with the loss of your father. I mean, I'm just, you know, mind blown. You know, it just shows me right here in you know, the country that rules the world, in America and the UK, and we are just so far from where we need to be to deal with these conditions. It's just crazy.
I think
Jenny.
it's tricky because I've been very lucky in that I have had some programs that have offered that mental health support, but I think often at the wrong times and with the wrong kind of professionals. And I think I sought it quite early on, but often the professionals you talk to aren't trained in dealing with people with chronic conditions. They are trained in dealing with people with mental health conditions. And I think it's quite different in the fact that they don't understand the impact. And like you were saying, they don't understand the impact on relationships or the impact on what job you might want. And they can't give you anything from that to kind of help you manage a loss, essentially. And I also think, like Annie was saying about people just telling her that she's depressed, I often find if ever I go to seek mental health support in the UK, it's a tick questionnaire. And there is, do you feel tired all the time? Well, yes, but because I have a chronic condition, not because I'm depressed. And I often get a much higher score in depression, but it's because a lot of those things on the tick box are attributed to my chronic illness, my chronic physical illness, rather than depression. So I think that's the balance that we've got to find. And as I said, I went on the Royal National Orthopaedic Rehab course, which is a really excellent pathway for people with EDS in the UK. And it has physio, it has occupational therapy, and it has psychology all intertwined. But you get very little hours with the psychologist. And there's not enough time for them to kind of explain that they are there to support your pain management and your physical condition. Because like you were saying before, there's a lot of anti-mental health help because they're like, it's not in my head, I don't need that.
Yeah, absolutely.
What you're saying is true, but I think it takes a little while for us to, you know, I know now that definitely I would take the mental health help regardless of any actual mental health issues I have, because it does support you in that way. But I think at the time where I was on that course, I was quite closed off in the fact that it didn't feel like a mental health thing at the time, even though I know how much it does impact my mental health.
If I may say, then I think that's really sort of good point that Jenny you made, because just the fact that it would be all Laura whoever said it first, but it should be like offered as a help or as a discussion after you've been diagnosed, because then you would get sort of information and sort of tools to help with the fact that you're going to have to change your life in some ways, eventually at least, or it's going to change your life, or you're going to have to make changes. Because I applied through my work to rehabilitation course that was from our social insurance institution. It organized this. It was a 6 weeks course through like a year and a half, like 1 week each time, and was 6 times. And there we got to, or there's like, it wasn't for HSD or EDS. I was there with people with all different sorts of problems, but all had some sort of health issues. But there we talked to psychologists and we talked to like all sorts of things. Because they were there to talk with people who had chronic illnesses of some sort, or if not sort of chronic illness, maybe not all of them, but some sort of like physical thing or some sort of illness that they needed help for and were there for that course to get some help. So they basically were talking about, okay, how you're going to do at work, what you should be doing, and do you need more rest, or should you take breaks during the workday, and all sorts of that kind of things that I hadn't thought before. After the first session, I was like, no, I mean, this is kind of stupid. Was my first reaction. It's like, I know how to eat. Well, I don't, but I mean, I sort of know how to eat, you know.
Mm-hmm.
And I know when I'm tired or whatnot. Turns out I don't know that either. But because I went for 6 months for sleeping about 4 hours a night, because I was just fine. I wasn't tired at all until I got meds to help me sleep. And then I was able to sleep through the night, and I realized how really like tired and just hyper I'd been for it.
Well, we're so used to our normal that we don't realize that that's not actually normal. And another thing that we all see as normal is relationships. And we've all kind of touched on this, but I think that that's an area that people don't realize is something that's really impacted when it comes to living with a chronic condition, in lots of different ways, whether it be, a spouse, partner, siblings, friends, parents. It can be really, really hard. Sabra, talk to me a little bit about how you feel like your health has impacted any relationship around you.
Yeah, it definitely has. I found as I've been getting older, and my symptoms have been getting worse, a lot of them. I kind of don't talk as much about my EDS because I felt like people be like, oh God, here she goes again, like talking about, whatever. And so like, I've noticed too, unfortunately, as I've gotten older, that a lot of invitations have slowly gone somewhere else, or mine was lost in the mail, because I used to be invited to a lot of things, and sometimes I have to cancel because of an EDS flare up of fill in the blank. And I think sometimes people can understand that, and then it's like to a point like, okay, like, so that's been a little difficult, because, right when I got diagnosed, like I said, I was 12, and that was like at the peak of like puberty and everything else and figuring out myself. And, in high school, I would try to be, like I was really social. And then like things happened, like I started to have to use a scooter, which my friends were like, okay, you're 14 years old, you want to go to a football game, maybe not in a scooter. No, I don't think that's really cool. So it's been tough. And even in like my romantic relationships, I think to a point people can understand and empathize things, but then they're like, okay, when you say, oh, I'm too tired to like get out of bed or to do anything, like I don't want to cook, go to a movie, I don't, sitting down even hurts for too long. I think after a while, certain partners, like they can deal with that, but they might be thinking in the back of their mind, like, okay, or literally when I say, yeah, it's fine, go ahead, you go without me, like I'm not trying to make you feel bad, I am fine on the couch watching Netflix. And they're just like, no, I'll sit here, but then you feel guilty. So it has been definitely difficult with a chronic condition.
And I think what's hard as well, especially with EDS and HSD, is how sporadic it can be. I remember growing up where one day I could be break dancing and jumping around, and the next day I can't move, and then my mum would ask me to clean up or tidy my room, and I'd be like, I can't. And they were like, well, you were break dancing yesterday, what's your and they don't understand. And I think that you see that a lot in kind of parental child relationships, but you see it in partners as well, where they're like, you were okay yesterday, I was really looking forward to going to the movies or going out for dinner, and now you just want to sleep. And it's so hard for even the most compassionate and understanding people to understand how you can just be like that all the time. And it's not just that, you know, it's the physical relationships that come from, you know, when you're going out with people, when you're married, that are impacted by chronic health. It's everything. And in between, it's also the, like we were talking about, the psychological aspects of living a life with someone whose dreams and aspirations may have been impacted or changed because of that chronic condition. Annie, I was just joking and waving to Jason, who you married very, very recently. And obviously, you know, you've had your experiences navigating living with VEDS in a relationship. Talk to me a bit about that.
Well, so Jason and I it's been difficult with all relationships. I will say that, okay, so first, a majority of my relationships have suffered since my hospitalization. I think a lot of people got scared. They don't really know how to react, and I think avoidance is easiest. Jason and I first started seeing each other about a year before I had my major complications and hospital stays. And I don't think he really knew what he was signing up for. I think he was like, yeah, I hear ya. And then all this happened and he was like, oh crap, she was serious. And I'm sure he's had some second thoughts. But he, you know, I want him around because he knows how serious it can be. And he's seen it firsthand. And he didn't go off running. He still stood by my side and held my hand and laid in my hospital bed. And he still rubs my feet and does all that. And he's very understanding. He, you know, sometimes I will have to say 1 or 2 or 3 times, I'm tired, I need to go to bed. And he is probably the one person in my life that totally is like, okay, you do what you need to do. I love you. I want you to be well. My mom is another person who totally understands where I'm coming from, and my best friend Chelsea. Those are the 3 people that saw firsthand what I went through in the hospital and know that, you know, like, I'm not faking it. I'm not trying to get attention. Like, I'm serious when I'm saying I'm in pain or tired or not having a good day. All the other relationships, who needs them?
Yeah, and sometimes just a few really good ones can make all the difference. Anna, have you experienced the same?
Well, not really. I mean, yes and no. I mean, there are people who don't understand, but part of that is also because I don't tell them. I only sort of have, I think I have separate sort of friends, like friends who are also ill. And then there are other people. And then the other ones, I mean, you have to tell sometimes, or just they see like the braces and all that stuff, or I tell them that, oh, sorry, I can't lift that, or could you help me with that, or whatever. But then but I don't need to sort of, because I know that I just see their like eyes glazing over, because if I start talking about these things, it's not like they don't want to hear, and they don't really need to hear. They are for other things and other kinds of, you know, other parts of my life as well. I've sort of compartmentalized my life sort of in different things, who have different people for different things in a way. Of course, I have friends who I've known some all my life, some very long time, and they, of course, been through with all the ups and downs and whatever has happened in my life. But I still sort of, I mention things to them, but I try not to unload to those people. I unload to those people who understand or who go through the same things.
Yeah, no, absolutely. And Jenny, tell me about your experiences.
Yeah, I think as Anne was saying, like those friends that are ill become real friends. I started kind of a little mini Zoom support group during lockdown, the first lockdown, and we've kept it up. every other week since then. And I've met 2 of them in real life once, but the whole group has just bonded. And I think that's such an important relationship to have as someone with a chronic illness, is people that you don't have to explain everything every time, and just get it, and will get the impact of things. So if you say that you've got all this to do, other people might not think that's very much, but they get how much of an impact it is. But I think my romantic relationships, my relationship with my ex-partner was very, very difficult when it came to my health. And I wrote a big blog post about this because it was something that I felt embarrassed about at the time, when I think actually that is such a hard thing to go through as someone who's in their early 20s. And I'd been with my ex-partner for about a year when things started going wrong with my health. And I think the main problem with our relationship after that was that he didn't understand that I wasn't going to get better. And I think that's such a hard thing to navigate. And I started doing things that were hurting me physically more. Like, he wouldn't like it when I kind of use my mobility aids, when I know how much those help me. And, you know, I'm a massive advocate for doing what helps you. And then in private, I was not using them because I didn't want him to feel strange, and then suffering afterwards when he wasn't seeing. But I think that I thought that because he was staying with me and he'd stayed with me through all this stuff, that he was really great for me, when actually that wasn't the case at all. And his response and the way he used to behave towards me is night and day compared to my partner now, who is just incredible. And don't get me wrong, I get scared, like Annie was saying, that sometimes he doesn't know quite what he's taking on. And I get scared that when he maybe does realize that, then he might be a goner. But I don't think that's the case. And I think as well, like you were saying, how sporadic this condition can be, and that can be so difficult for relationships. He just seems to get that. Like this morning, I work as a children's party entertainer. I was being Queen Elsa all morning, and I was dancing around with kids, and a lot of people will be like, well, you were princessing this morning, so surely you're fine. Whereas when we were going to the supermarket this afternoon, he was like, why don't we get you walk around? Because he got that was really difficult on my body. He knows how much I love it and want to do it, but he knows that the reaction now is a hell of a lot of pain. Whereas no one else has ever quite got that so instantly.
Yeah, I think for sure when you find someone that gets it, it means so much. And I think also what you touched on as well is the tremendous support that the community provides, which is just incredible. So we've all had different journeys to the point of diagnosis, some short. I'm actually delighted to hear that most of your kind of journeys to diagnosis were relatively short compared to the average of 12 that we hear about in our community. Mine was 11 years. So, but no matter where that point was, what would you say, knowing what you know now, to your younger self, if you could? And Sabra, I'm going to start with you.
Okay. I would definitely tell her to keep talking, because, you know, a lot of times I just think, like, gosh, again, like my mother, if she didn't speak for me, with me, defend me, like how my life would have gone. I would definitely tell her she is right in her pain. A lot of times, like I said, when I was younger, I kind of, you know, doctor would say, how are you? And I'm like, I'm fine. You know, I didn't really go in depth as much as I should have. Like, you know, you're not fine. Your hip dislocated right before you came in this building, you know, like, so, you know, but I would just like, I'm okay, I'm fine. Because in my mind at like 14 or 15, similar to what Jenny said, actually, I was thinking, oh, this will, it'll get better. Even though the doctor told me, oh, it's degenerative, I was just like, no, it'll get better. So like, I would tell her definitely keep talking, keep advocating, explain yourself. Your feelings are valid. Everything that's going on with you physically, mentally, it's real. And it might not get better, but you will have so much support if you just talk about what's going on.
Amen. Anne.
I would probably tell myself to learn body awareness. I wish that somebody would have told me at some point that when I have such pictures from my childhood that I remember people telling me that, like, stand up straight. Like, I'm standing up straight. No, I'm not. I can see it all the photos. I'm like hanging on one hip and being all crooked to one side, but that's like, I'm standing up straight. What's wrong with that? So I wish like somebody had taught me how to, corrected me or just told me how to be. And I would really tell my younger self to just learn that. Just, it's taken me years. And I mean, I don't think that people even, until they start doing something, either be it physical therapy or Pilates, like in my case as well, or something, that they start to realize that how crooked they are. They don't even see it in themselves, that they're not straight or like incorrect position with the bodies.
Yeah,
So.
no, that's a great point. A great point. Proprioception and posture and those small things that, if that's why, again, I push for early diagnosis, because if those things are fixed from early age, then the difference in quality of life and the ability of movement is so huge. It really is. Jenny, what would you say to your younger self?
I think the same kind of things that Sabra was saying in terms of advocating for yourself. I think I don't think it's something that anyone ever thinks they're going to have to do when it comes to healthcare. You kind of go to a doctor and expect things to be fixed or have answers. And I think that's what I've learned the most on this journey, that you have to keep advocating for yourself and keep pushing it, because doctors are stubborn, and you've got to know what's out there and have the knowledge and then advocate for yourself. But also knowing your worth, I think, is really, really important, because, despite these conditions, we have so many other skills and we have so much to give. And I think people can forget that sometimes, and we can kind of be clouded with this, oh, she's sick kind of thing, when actually we've got so much to give and people should recognize that. But this is like 3 things, but there we go. I've got a lot to tell my younger self. I think finally is that you're not alone, because I spent so much time thinking I was the only person in the world going through this, and not realizing that there was this massive community out there who's so willing to support and help. And, I've met some of my best friends and some incredible people through this journey and my advocacy online, and they support me every single day. And I don't know where I would be today without that support. So I wish I'd found that sooner and realized I wasn't alone.
Absolutely. Annie?
Oh man. So definitely be patient, but more importantly, be patient with myself. I have a tendency to be really hard on myself and get down on myself on silly things. And just be patient, but enjoy the ride, and know that it's all going to be okay. Even if,
You know what, I was going to say exactly the same. I would tell myself it's going to be okay. Simply that. Because I think about how many 15-year-olds there are out there still that are so scared and so alone, and maybe not being diagnosed, or being diagnosed and that being even more scary because there's just no help. And I just kind of want to say it will be okay to every age out there, because it will be, it has to be. I think, I'm so proud of what the society has done over a short space of time, and I think things are getting better. I've heard from your voices today, we are so far from where it needs to be. But I think what we need to remind ourselves is that there was 20 years there since the 1997 diagnostic criteria to the 2017, where there was nothing. It was siloed efforts going on. We had a few heroes dotted around the world that were doing great things. No one was collaborating and coming together. We have seen a huge increase in publications, collaborations, research funding. You know, there is still such a way to go, but what I believe we've done is built some really strong foundations for us to all now go from and grow from, and get to a point where it seems laughable that you would wait any length of time for that diagnosis. That diagnosis would mean you could get care locally, that management, that validation we speak of, and that it wasn't just something that you had to hope for. And as I've said before, Sabra, are you still with us? I think your camera may have gone off.
Still with you. Sorry, I'm fixing it.
No problem. You know, as I've said earlier, this has been a hell of a year. It's December now, 2020, and I don't know about anyone else, but I'm feeling optimistic about next year. I'm feeling good. I think it's going to be a good year. I think it's going to be another challenging year, but for different reasons. And I'm known for always looking for the silver lining and for remaining ever hopeful. And so I turn to you all, and I'm going to ask you in one sentence what you are hopeful for and what you wish for in the next 10 years for EDS and HSD. Jenny.
Wow, I'm not a one sentence kind of girl. I think better knowledge, greater understanding and awareness, and better support for patients, and better training for medical professionals.
Annie.
Same with VEDS, yeah, same thing. Just more support, more knowledge, more education, more understanding, more compassion. Just, yeah, all of that. Let's make it happen.
Absolutely. Anne.
Yeah, the same thing. And if I go to more specifics, I'd really like the new criteria to be really taken on as something that's used everywhere, and with also HSD and being seen more just than what it was in the 60s. And, you know, to have the different types of HSD also to be recognized, and for the people to get sort of correct kind of help for the issues.
Absolutely. Such a good point about HSD. People still think that it's less than hypermobile EDS, but not at all. You know, you can have someone who is working full time, who could be an athlete who meets the criteria for hypermobile EDS, and someone who is unable to walk, is unable to work, and has HSD. It's not better or worse than, it's just different diagnostic criteria, and both need exactly the same care, attention, and focus and research and acknowledgement. Absolutely. Sabra.
To echo basically everyone, I agree. I think I hope in 10 years we have a lot more education and knowledge within the medical field. I hope that one day I can say I have Ehlers-Danlos syndrome and it will be more commonly known. You know, of course, there's different facets to it, but at least someone will know what the heck I'm talking about and not have to go through, well, it's a connective tissue disorder. I hope that at least people know that. And I really hope there's more empathy, you know, within the next 10 years with our condition, because it is so varied. And I just think a lot of times, like you all mentioned earlier, like one day I could be dancing and then the next day I'm bedbound. And I hope that people learn to just have more empathy.
Absolutely. Amen to that. And, you know, I wish for all of that and more. I think for me, it really starts with research. And I had a dream that we would be able to offer out at least $1 million a year for this, you know, the healthcare professionals to do the research that's needed, that leads to the therapies, that leads to the treatment, that leads to the cure. And I think it all starts with that. And there was so little funding for so long I'm delighted to say this year we did give $1 million. Next year we've got $500,000 pledged, but I still remain ever optimistic despite being in these trying times. And that's my biggest wish, that, you know, as a non-profit, in times where people are struggling with a condition that no one's heard of, you know, when you break outside of our community, people want to give to cancer, mental health conditions, heart conditions. People hear about EDS, they think it's just a bit bendy, but it's so much more than that. We need so much help. We need so much support. We need so much funding. We have so many people to support and take care of. And it's my wish and my deep, deep wish that we're able to do that for a long, long time to come, and support not just the patient community, but the health professional community, who are working so, so hard for us all and caring for us tirelessly, giving so much of their time. And I'm ever grateful for everyone. I could talk to all of you for hours, genuinely. I've absolutely loved this time with you. I've loved bringing your voices out to the community. We have a lot of barriers to break down. You're all representing one form of barrier or another that you've experienced. And I'm so grateful that you've shared what you've lived through. And I hope that people realize they're not alone from hearing this. If anyone listening is interested in taking part of our conversations with Sirius, we'd love to hear from you. Drop us an email, comment on this post. And I'd like to thank Jenny, Annie, Anne and Sabra for taking this time out, speaking to us. We're ever grateful for you. Thank you, everyone. Good night from London. Good afternoon from the US, and even later for Anne in Finland. Thank you and good night.